Hey there, viewers! The mouth tells a lot about the body's well-being. Several diseases like diabetes, HIV, mouth ulcers, and dry mouth are often first detected within the oral cavity. Improper care and constant disregard to oral hygiene leads to cavities, tooth decay, and loose teeth. It's also unsightly to have poor oral hygiene as it reflects on your appearance and personality. Bad breath, bleeding gums, yellowing teeth, tartar and plaque are all signs of poor oral hygiene. Thankfully, maintaining good oral hygiene is not a difficult task. And in today's video, we'll give you the best tips for good dental health. From eating healthy, avoiding snacking, replacing your toothbrush regularly, staying hydrated to visiting the dentist, and more. Watch till the end to learn about all of them. Number 1. Brush the right way. Are you brushing regularly but you still have dental problems? The problem isn't how many times you brush your teeth, but how you brush your teeth, and for how long. It is recommended that you position your brush at a 45-degree angle to your gums, then brush back and forth with short strokes to clean the top and sides of your teeth. When cleaning the front and back teeth, place the brush vertically and use short strokes while brushing. Brush your tongue and palate to get rid of food residue that might have gotten stuck. Take at least 2 minutes to brush your teeth. This will ensure food residue on the surface of your teeth and tongue are eliminated. Have you been brushing your teeth using the correct technique? What were you doing wrong? Tell us quickly down below in the comment section. Number 2. Eat healthy. Nutrition is just as essential as oral health. What you eat will influence the overall health of your whole body, mouth included. Foods rich in calcium such as green leafy vegetables, dairy products, and fish like sardines are the right types of foods to include in your daily meals. Sweets and starchy foods such as fried potato chips and refined flour tend to stick to teeth. When the teeth are not cleaned properly, starchy food and sweets break down into simple sugars. Bacteria feeds on these sugars and produces acid that causes tooth decay. After eating such foods, it is crucial you brush your teeth thoroughly to avoid acid buildup. Number 3. Use fluoride. Fluoride comes from an element in the Earth's soil called fluorine. Experts suggest that fluoride helps prevent cavities, and it is a common ingredient in toothpaste and mouthwash. However, some dental products don't contain fluoride, and some people don't use it at all. Evidence suggests that a lack of fluoride can lead to tooth decay even if a person takes care of their teeth otherwise. Brushing and flossing won't prevent cavities if you don't use fluoride. Number 4. Avoid snacking. Aim to only have 3 main meals a day with minimal snacking. Snacking promotes more plaque acid in the mouth, which leaves the tooth surfaces more susceptible to decay. Sometimes it's not the food we eat, but how often. It's important for teeth to have a recovery period after every acid attack. If you're peckish, try snacking on popcorn, cheese, milk, or water. Number 5. Use mouthwash. Mouthwash is a liquid used to rinse your teeth, gums, and mouth. It usually contains an antiseptic to kill the harmful bacteria that can live between your teeth and on your tongue. Rinsing with mouthwash twice a day will help reduce plaque, freshen your breath, and reduce cavities. It can also keep your gums safe from gingivitis. Number 6. Be aware of teeth grinding. Teeth grinding can be a result of stress, anger, concentrating, or feeling anxious. Many people don't even realize they're grinding their teeth because it happens during their sleep. If you experience worn tooth enamel, increased tooth sensitivity, or torn cheek tissue, you may be grinding in your sleep. Although dentists can't stop you from grinding your teeth, they can make a special mouthguard to wear at night to protect you. Number 7. Avoid tooth stains. Tobacco is not your friend and your teeth's worst enemy. It will not only stain your teeth but will cause periodontal disease, gum recession, and tooth loss. Tobacco affects the entire body and is known to weaken the immune system, making you prone to infections, and the mouth is no exception. Coffee and soft drinks cause staining. Tannins in coffee deposit on the surface and build up with frequent consumption. When drinking coffee or tea, you can protect the teeth by using a straw. Number 8. Replace your toothbrush regularly. Many people forget to replace their toothbrushes. You should start using a new toothbrush at least every 3 months, or if you've been sick. If your toothbrush starts to look worn, replace it as soon as possible. Old or worn brushes won't clean your teeth effectively and could increase dental problems like decay. Number 9. Wait before you brush. In the habit of starting your morning off with a glass of orange juice, you're going to want to hold off on brushing afterwards. Food and drinks with a low pH, that is, acidic foods, temporarily soften the enamel of the teeth. If you immediately follow up with brushing, the action could remove some of the enamel, making your teeth more susceptible to decay over time. So your best bet is to delay brushing after you've had citrus fruits and juices, tomatoes, soda, and wine. One study found that people who waited 30 to 60 minutes to brush after drinking soda had less wear on their teeth than those who brushed sooner. Number 10. Floss regularly. Brushing may come before flossing in the dictionary, but it shouldn't when it comes to your teeth. Research shows that flossing before brushing is the best way to clean teeth effectively. The action of cleaning between the teeth loosens bacteria and food debris. This allows brushing to be much more successful at removing plaque. Studies show that those who floss before brushing are left with a much cleaner mouth than those who do it afterwards. Number 11. Spit, don't rinse. After you've brushed your teeth, spit out the toothpaste. At this point, you might be tempted to rinse the mouth out, but doing so will wash away the fluoride, which continues to help protect the teeth. Fluoride is the most important ingredient in toothpaste. It greatly helps oral health by strengthening the tooth enamel, making it more resistant to decay. Spitting out the excess paste and not rinsing ensures that the fluoride will continue to be effective. Number 12. Stay hydrated. Drinking plenty of water every day helps us to stay healthy. It's generally recommended that men drink about 4 liters of fluid a day and women about 3 liters. Water is the main component of your saliva, which fights bacteria. It also helps to neutralize acid that causes tooth decay while washing away excess food particles and bacteria. Furthermore, it keeps the soft tissues of the mouth moist and healthy, which helps fight bad breath. Drinking enough water is not just good for your teeth, it has a wide range of benefits for your whole body. Learn more by watching 8 Benefits of Drinking Water. Now back to 15 things the dentist wants you to do for better oral health. Number 13. Use the proper equipment and keep it clean. Use a fluoride toothpaste and a soft bristled toothbrush that fits your mouth comfortably. Consider using an electric toothbrush, which can reduce plaque and a mild form of gum disease more so than manual brushing. These devices are also helpful if you have arthritis or other problems that make it difficult to brush effectively. Always rinse your toothbrush with water after brushing. Store it in an upright position and allow it to air dry. Try to keep it separate from other toothbrushes in the same holder to prevent cross-contamination. Don't routinely cover toothbrushes or store them in closed containers. That can encourage the growth of bacteria, mold, and yeast. Number 14. See a dentist regularly. It is recommended that you see a dentist every 6 months for a checkup. During a routine dental examination, they can clean the teeth and remove plaque and hardened tartar. The dentist will also check for visual signs of cavities, gum disease, mouth cancer, and other oral issues. However, adults who practice good dental hygiene every day and have a low risk of oral health problems may go less frequently. You can speak to your dentist about how often you need a checkup. The answer may vary depending on a person's health history, age, and overall dental health. However, if you notice changes in your mouth, you should definitely visit a dentist. Number 15. Avoid alcohol. Alcohol can also erode the outer surface of the teeth, leading to a loss of enamel. If this happens, you may need to go to the dentist for a filling. Drinking too much has also been linked to an increased risk of developing mouth cancer. The most important risk factors for mouth cancer are the combined effect of smoking and drinking alcohol. It's estimated that heavy drinkers and smokers have a 38% higher chance of developing mouth cancer than people who neither drink nor smoke. While following these tips can give you great dental health, it's very important your teeth look good and are strong. Learn how to take care of your teeth by watching Ways to Whiten Your Teeth Naturally, or Ways to Strengthen Your Teeth. These 2 videos will definitely help you keep your teeth in the best shape possible. So go ahead and watch one or both of these videos for maximum benefits. How often do you go to the dentist? Let us know in the comment section below.